This Wednesday the 27th, you will be voting on the pay offer of 2.5% from the government for the Public Health System Nurses and Midwives State Award. Once again, as they have for the past 7 years, the New South Wales State Government refuses to negotiate award improvements to deliver better mandated nurse-to-patient ratios. This isn't good enough for the safety of patients, and it isn't good enough for hard-working nurses and midwives. The recent state budget announcement of 950 nurses and midwives is about future service growth in our health system. It does not address your award claim. Yet again, our state government is recording billion-dollar surpluses, but does not want to spend any of that money on improving patient safety. The current position for your 2018 award is this: the Ministry of Health refuses to apply ratios shift by shift instead of averaged over a week, refuses to provide specials in addition to the numbers, refuses to count babies in postnatal, refuses to stop using the midnight census to undercount patient numbers, refuses to extend ratios to small hospitals and specialties like paediatrics, emergency departments, critical care, some mental health, community and community mental health. Your award ratios claim has been met with a complete refusal again. Your claim for a better pay rise of 4% has also been refused. What has been offered is a 2.5% pay rise for the next 12 months. So now it's time to vote. Voting yes is the option that your elected New South Wales Nurses and Midwives Association Council is recommending to you. We believe you should receive the pay increase and that we continue to campaign beyond the limits imposed on us by the New South Wales Government's unfair wages legislation. So what does voting yes mean? A 2.5% pay rise effective the 2nd of July 2018. All other existing award conditions would remain unchanged. You can continue to enforce your existing nursing hours ratios and your rights to a reasonable workload. This right to a reasonable workload exists outside of those nursing hours wards. The Ministry, management and the media are sitting up and taking notice. The Ministry of Health has forced local health districts to put the results of nursing hours staffing on every ward every week and sent out an edict that the award must be followed, albeit 7 years late. This is because branches are standing up and enforcing their rights to safe workloads. If you vote yes, the next step is to increase the pressure even more and protect every nurse and midwife's professional obligation and right to practice safely. That means we need to continue to campaign publicly to get the government to change their position. What does voting no mean? Under the current laws, any pay increase higher than 2.5% would require specific award trade-offs from your own pocket. So at some point this year, you would need to consider whether you are prepared to do that, as the government has no intention of changing their bad laws. Under the current laws, better guaranteed ratios would also require specific award trade-offs. Only a government decision to properly negotiate would change the outcome. Voting no does not guarantee that the government will come back to the table and start negotiating a better offer. By voting no, you would need to undertake the same actions to win better ratios as those if you vote yes, but you would risk not getting the down payment of 2.5% that is currently offered. Our fight for better, more transparent nurse-to-patient ratios must now be stepped up. I recommend that you accept the 2.5% pay increase offer for July 2018, and I strongly urge you to join your fellow nurses and midwives across the state and condemn the government's 7-year refusal to negotiate genuine award improvements without trade-offs. We must stand together and raise community and politicians' awareness about how better ratios can stop the understaffing and risks to patient safety, and safeguard our professional registration and patient care obligations by determining on each shift whether our employer has provided enough nurses and midwives with the right skills. My recommendation and your council's recommendation is to vote yes and continue to campaign for ratios.